Welcome to The Explainer. In the entire world of medicine, there are few places as intense as the intensive care unit, the ICU. It really is the front line of life-saving care. Today, we're diving into a really fascinating development, something that could give doctors on that front line a new kind of superpower, an AI that can predict a patient's outcome a full 48 hours into the future.
The ICU it's one of the most data-rich and high-stakes places in any hospital. Just think about it. Doctors and nurses are constantly swimming in a flood of information, and they have to make these life-or-death decisions based on a patient's condition right then and there in that split second.
So imagine a tool that could sift through all of that data and give a really reliable forecast, a prediction of a patient's mortality risk over the next 2 days. That would be a total game changer for how care is prioritized and delivered, right? Well, that's exactly what this new machine learning model we're about to unpack is designed to do.
All right, let's get into it. First, we're going to look at why prediction is such a tough problem in the ICU to begin with. Then, we'll introduce this new AI model, the LGBM-48H. After that, we'll check out the evidence to see if it's actually a smarter model, see how it works in the real world, and finally, we'll zoom out and talk about what this all means for AI in critical care.
Okay, so first up, why is a new tool even needed? Well, for years, ICUs have used these clinical scoring systems. You might have heard of them, things like the SOFA or SAPS II scores. But here's the catch. They all have one huge limitation. They're totally static. They take a snapshot of data right when a patient is admitted, and that's it. That score never changes.
And this is a really big deal, as the source paper from Communications Medicine points out. A patient's condition in the ICU isn't static at all, right? It's incredibly dynamic. Things can change hour by hour, even minute by minute. A single snapshot at the very beginning, well, it just doesn't come close to telling the whole story.
So, this is where the new model enters the picture. It's called the LGBM-48H. Now that's a mouthful, but it stands for Light Gradient Boosting Machine, that's the AI part, and 40H for its 48-hour predictive window. And it's designed from the ground up to be the dynamic tool that clinicians have been waiting for.
So, what does it actually do? Well, the LGBM-48H is a machine learning algorithm that's always learning. Every single day, every 24 hours, it pulls in all the latest patient data. We're talking vitals, lab results, medications, you name it, and it generates a brand new prediction for that patient's mortality risk over the next 48 hours.
Honestly, here's the best way to think about it. Those old scores, they're like taking a single photograph of a runner at the very start of a marathon. But the LGBM-48H, that's like having a time-lapse video of the entire race. You see the runner's progress, their struggles, and their entire trajectory from start to finish. It's a completely different picture.
All right, that all sounds great in theory, but the real question is, does it actually work any better? Let's take a look at the hard evidence from the study.
The difference in approach here is really stark. The old way is just a single, fixed assessment, but this new way, it's like having a continuous conversation with the patient's data. It's not just looking at a handful of variables one time. No, it's processing a massive stream of information every single day, which lets it adapt its predictions as a patient's condition changes.
And this chart right here really puts numbers to that difference. It shows a standard measure for accuracy called an AUROC score. And the easy way to think about it is this. A score of 0.5 is basically a coin flip, and 1.0 is a perfect prediction. So you can see the old scores, they're hovering around 0.7, 0.77. But the LGBM-48H model, it jumps way up to almost 0.9. That is a massive leap in predictive power.
So a really important thing to understand is that this isn't some black box AI just spitting out numbers. Its power really comes down to 3 key things. First, it's more accurate than what doctors are using now. Second, it's dynamic. It adapts every day. And this last one might be the most important of all. It's interpretable. It doesn't just say a patient is high risk, it actually tells the doctors why, pointing to the exact factors that are driving that risk.
Okay, so let's bring this down to the bedside. How does all this data actually translate into a practical tool? How does a doctor use this information to make a decision?
Well, the model is really smart about how it communicates. See, one of the biggest problems in the ICU is alarm fatigue. So many alerts that they just become noise. So instead of just giving a raw percentage, the model groups patients into 3 really clear categories: low, intermediate, or high risk. This helps clinicians immediately focus their attention exactly where it's needed most.
And the research paper gives this really powerful example of 2 patients to show how this works. Check this out. Both patients start out with a low-risk score on their first day.
Patient A stays in that low-risk category the whole time, and great news, they survived. But look at patient B. Their risk just climbs from low to intermediate and then to high, and tragically, that patient did not survive.
And this is where that interpretability we talked about becomes so incredibly powerful. For patient B, the model didn't just wave a red flag. No, it basically handed the doctors a diagnostic roadmap. It pinpointed the exact physiological reasons the risk was going up. Their oxygen saturation was getting worse, they needed more circulatory support, their lactate levels were rising. It turns a generic warning into specific, actionable clinical insight.
Okay, so let's step back for a second and look at the bigger picture here. What does a tool like this really mean for the future of the ICU?
You know, beyond predicting who is most at risk, maybe the model's greatest strength is actually predicting who isn't. The study points to this one incredible statistic. It's negative predictive value, and that value is 99.1%.
So what does that actually mean? Well, in plain English, it means that if the model puts a patient in that low-risk category, there's a 99.1% chance they will survive the next 48 hours. Think about the confidence that gives clinicians. It makes the model extremely reliable at identifying stable patients, which could be absolutely revolutionary for managing things like bed capacity and allocating those precious ICU resources.
And really, this brings us to the most important takeaway. This kind of technology isn't about replacing doctors. It's about empowering them. So the real question for the future isn't about the AI, it's about us. How do we best partner this incredible predictive insight with the irreplaceable experience and intuition of a human expert? Because that partnership, that's where the true revolution in patient care is really going to happen.